Hi you guys, welcome back to my channel. It's Crystal Christine, and today this video is going to be geared towards pre-nursing students. Okay, today I want to talk about how to do a head-to-toe assessment. Before you start your head-to-toe assessment, you want to make sure you go into the residence room, knock on the door, and introduce yourself, and just let them know, what you're there for. For example, you can knock on the door, wait for them to tell you to come in, and once you entered into the room, you say, "Hi, how are you? My name is Crystal. I'm here to do a basic head-to-toe assessment on you. Is that okay?" And once you get the okay, then you can go ahead and start your head-to-toe assessment. Make sure you ask the resident if they're in any pain, because if they're in any pain, then maybe you can notify the doctor. Make sure you locate where the pain is, so you can also maybe get them something while you're doing, if they have something that already scheduled for them, maybe you can give them something for their pain, because you will have to be turning them back and forth, and you don't want your patient uncomfortable and in pain while you ask them questions or even looking at their skin. So with that being said, you want to start with your vitals. You could delegate your vitals to a CNA, but it's best for you, when you're doing a head-to-toe assessment, to go ahead and ask the nurse to get the vitals yourself. So you want to make sure you get your blood pressure, you want to get your heart rate, you want to get your respirations, your temperature, and your O2 saturation. Also, make sure that you get your pain level, because pain level is a part of your vitals. So while you're doing that, and you could be asking your resident, some questions as far as where they at, where they come from. You can even ask, do they have any children? Just trying to communicate with your resident is good, because you're starting with the you're doing a neuro assessment just to make sure that their mental status is okay. Okay, so after you get through with your vitals, and you just want to go ahead and just basically, take a look at their head, look inside of their hair, look at their ears, make sure, see if they're wearing hearing aids, see if they're wearing glasses. You want to make sure you're looking at how their eyes react to light. You want to make sure you checking their pupils. You want to make sure you checking their lips and see if they dry, they cracked. You want to look inside their mouth, checking their mucous membrane. Let's see. See if they're wearing dentures as well. You want to also make sure that you're checking to see if they're wearing dentures, if they have how many teeth they have, if they have any cracked teeth, how many teeth is missing. You want to make sure you're looking at the color of their skin. When you get through with that, you want to go ahead and start checking their lungs. Once you check their lungs, you're listening for any wheezing, cracking. You listen and see if you hear any heart murmurs. You listen and see if you hear any rhonchi. Excuse me. You want to make sure you hear the S1 and S2. They have a normal heart rate. And once you get through it with your lung sounds, you want to move over and check their bowel sounds. You want to be asking your patient, when is the last time you had a bowel movement? When you had your bowel movement, was it normal? Ask them, did they have any blood in their stool? Was it hard? You want to because most of the time, these residents, they're taking different types of medication, and some of their medication is making them constipated. So you want to make sure that you are aware of what type of bowels your patient is having, so you can communicate that with the doctor, and maybe they can order them something, maybe a stool softener, so they can be comfortable. Because even with residents that's constricted to the bed, and they don't move around as much, and maybe they're not being turned every 2 hours, they can get constipated as well. So you just want to make sure that you are aware of these things. Also, when you checking their bowel sounds, making sure you want to just palpate around their stomach and make sure it's not hard in areas, because it could be, the resident could be in excruciating pain because they haven't went to the bathroom for a while, and they having pain in their stomach because they haven't had a bowel movement. And by them taking different types of medication can slow down their peristalsis. So you just want to make sure you get that taken care of, and make sure you notify the doctor of your findings. You want to also make sure that once you notify the doctor of their findings, you want to also, if they're not their own POA, you want to call their family, call the POA, and let them know what's going on with their family member, and make sure you document everything, because we all know as nurses, if you didn't document it, it didn't happen. So with that being said, make sure you document everything. Make sure you contact the family members, and make sure you contact the doctor so we can get something scheduled for these residents or these patients. Okay, now moving right along to your arms and your hands. Now, once you're checking their arms and your hands, you want to make sure that the skin is not clammy. You want to make sure you're looking at the color. You want to make sure you want to expect everything on their body. Make sure they don't have any bruising. Make sure they don't have any skin tears. And if they do, make sure you measure all bruises and all skin tears, and make sure you report it and document it as well. And also, let the family know as well your findings. You want to check their capillary refills. You want to check your radial pulses, your brachial pulses. You want to also check for edema or swelling in the arms and the hands. That's very much important, because somebody could have swelling in their arms and hands from edema. Make sure you're checking for edema. Next thing you want to go to is your legs. Now, when you checking your legs, make sure you do the same thing with your arms. You checking for bruises, you checking for skin tears. You want to check for to see if they are in any type of pain, or if it's swollen in that area and it's warm to the touch. Maybe they could have a DVT, and you want to get that taken care of immediately, and calling your doctor, and following the proper protocol, per your hospital or your nursing home. You want to make sure the patient is comfortable, making sure the resident don't have any pain or anything. When you're checking the legs, you want to also check for your posterior tibial pulses. You want to also make sure you're checking those pulses. You want to make sure you're checking for those pedal pulses, capillary refills as well. Let's see what else. What am I missing with the legs? Yeah. You guys also want to be mindful of how the patient ambulate. Do they ambulate by walker? Are they using a cane? Are they in a wheelchair? And also how they transfer. Do they need a Hoyer lift, or do they need a sit-to-stand lift? You want to also keep that in mind when you're dealing with a head-to-toe assessment on how the resident ambulates. Do they walk? What type of shoes are they wearing? Do they have an amputee? So you just want to make sure that you write those things down when you're dealing with a head-to-toe assessment as well. Like I said, anything you do, you always write it down. You have your little clipboard and your pen, and just making sure you write down everything, and you notify the doctor of everything and the family member as well. So moving right checking along for if they have any Foleys, if they have a central line, if they have check your lines. You're going to check for Foleys, you want to check for IVs, you want to check for central lines, and you want to make sure that the IV is patent. You want to make sure that they're hooked up correctly. Make sure they on the correct feeding. You want to also check your medication to your MAR and make sure that everything is correct, because you don't want someone laying up in the bed and they're getting the wrong type of medication or the wrong type of feeding. Just make sure you cover yourself. You nurses, you always want to cover yourself, because if anything happened, it all falls on you. Those residents are there, and those CNAs are there under your license. So you want to make sure that you're talking to your CNAs and letting them know if they see anything different in the resident. Make sure they tell you, because the CNAs, they are your eyes and your ears, because they see and they hear everything. So you want to make sure you pretty much communicating with your CNAs to let you know if they find anything, to report it immediately. Okay. If they have any dressings, if they have any wounds on them, you want to make sure you look at those, see when the last time those wounds and the wounds was dressed. You want to make sure you put the date on everything. Anything you do as far as a wound, make sure you change those wounds out. Make sure you cleaning them properly, especially if they have one, on their coccyx. So make sure you cleaning those wounds correctly. Make sure you changing the bandage and you writing your initials on it and the date, because the last thing you want to do is have another nurse come behind you and you didn't do none of your treatments, and that falls on you. So you want to make sure you're doing your job and you're doing it correctly. Or if you get a new admit and you didn't do your skin assessment correctly, or you didn't do it all the way through, and you didn't know that this person had a wound on their back, and it's like, okay, you didn't chart on it at all because you didn't know it was there. So what I'm just saying is, make sure you cover yourself. Make sure you do everything correctly. And the CNA is there to assist you if you need to turn someone over or move them over in a bed. So the CNA is always there to help you. And if you need another nurse is always there to help you if you need it. You want to also make sure you're looking at the color of their urine, making sure that it's not cloudy, making sure that it doesn't have a strong smell. Make sure that it's not any blood in the urine. So all those things you just want to check, because those things could be harmful to the patient, and you want to make sure you take care of it. So you can be safe under your license, taking care of these residents and these patients. You want to make sure you take care of them the best that you know how, because that's why you became a nurse, to take care of the residents. And we all, as nurses, we get so soft, because we see these people come in, especially if it's a facility, if it's like a rehab, we get so attached to these residents, and when they leave, we boo-hooing and crying. Or if someone just so happened to pass on, you get so sad, and yeah, the Lord just call them home, and it's nothing you can do about it. Just making sure while they're there in your care that you just take care of them to the best of your ability. So, okay, with that, I don't want to make this video too long. If you have a resident that's a new resident, and you're doing a skin head to toe assessment, making sure if they come in with something specific, make sure you focus your assessment. Make sure you focus your assessment on that specific area, if that makes sense. Just make sure you focus your assessment on that specific area. I mean, you do everything that you need to do, the steps that your facility require you to do, but make sure you do what you're supposed to do as far as treating the patient. So I just want to stress this, and I'm gonna keep stressing it, because when I'm at work, I always want to make sure I document. I mean, you want to document everything you see, as far as, everything, whether it's objective or it's subjective. Make sure you put everything down just to cover your butt. I don't care if another nurse come behind you and it's their shift and they go in to read your notes and they saying to themselves, oh, why do they got this, that, and the other in here, and they don't have to put all this in here. If that's what you feel like you need to do to cover your butt, then go and do what you have to do, regardless of what else, you know, this nurse is saying, because her license is not going to get taken if anything happened under your watch. So make sure that you do everything that you need to do. And especially when you going in for these head to toe assessments, please make sure you have the proper equipment to take care and do these assessments. Don't go in there starting an assessment and you don't have all your equipment, because now you're irritating the resident, and sometimes they don't even want to be bothered, and you in and out of their room because you didn't bring everything with you when you went to the room the first time. Once you get finished with doing your head to toe assessment, you want to make sure you thank your patient, because they're giving you their time, and sometimes they want to rush off to if they're not a new patient, they want to rush off to bingo. They want to go eat lunch, or they want to go eat dinner, and you interrupting them, and they was nice enough to let you go ahead and do, because some residents, they do refuse, and sad enough that you'll have to, you know, try to keep persuading them or come back at another time to get the head to toe assessment done. But make sure you thank your resident, because in all honesty, you know, we are there on their turf, because the nursing home, if they're there for long term, that is their home, and we're, you know, coming into their home and interrupting what they got going on. So you just want to make sure that you you know, get that taken care of, and make sure you thank your resident, make sure you have a smile on your face, and make sure you're communicating with them, because what residents like a pretty face, you know, like mine. You know, the patients like a pretty face coming to them and smiling and having a conversation, because every time I go into a resident or a patient's room, I got a story for them. So they like when they see me come around. So just make sure you be happy and thank your resident for, you know, the things that you need them to do in order to get your work done and to be able to take care of them the best that you know how. I said, once you get finished with all that, make sure you chart, you document their assessment. You want to call the doctor on anything you found abnormal. You want to call the family member, not just any family member. You have to call the POA and let them know, you know, what's going on. I like to do, even if they're their own POA and you have two POAs that's listed and it's the patient's and it may be a son or a daughter, I also like to give them a phone call too, because the patient may just forget on that you came into their room and you know, you did the assessment on them, or they may just be maybe half asleep or something. So just make sure you cover yourself and let them know if you found anything that was abnormal with the patient. Hopefully I covered everything. Hopefully I did. If I forgot anything, please forgive me. If you are already a nurse and you're watching this video, let me know some things that you may do differently. Leave them down in the comment box. Yeah, so if you like this video, please subscribe, give me a thumbs up. And I know I don't have too many nursing videos on my channel. I'm trying to get better at putting the videos out there for you all. You know, sometimes even if you're doing YouTube, or if you're not doing YouTube, sometimes as a nurse, when you do so much at work, when you come home, you just want it to be all about your family. So with that being said, I will try my best to put up more nursing videos. So if you like this video, give me a thumbs up, subscribe to my channel, and leave me some comments down in the box. Bye guys.